About 61,000 cases of endometrial cancer, if I'm saying it right, are expected to be diagnosed in the US this year. Now, one woman, Kristen Foreman, was in her early 30s when she noticed menstrual cycle irregularities. Now, she persisted in raising her concerns and after many tests was diagnosed with this cancer. She's joined today by Dr. Sharyn Lewin, Director of you know how guys are, we can't talk, Gynecologic Oncology at the Holy Name Medical Regional Cancer. Stop laughing at me, Center in Teaneck, New Jersey. Ladies, good morning. How are you? You know, guys can't talk early in the morning. You know how we are.
Hello, how are you?
Good
I'm doing
morning.
great. Thank you for joining us. So, Kristen, the signs and symptoms, what did you experience?
Um, I experienced just multiple hurdles associated with elements of this journey that don't have to directly deal with my I'm sorry. I experienced multiple symptoms outside of the physical. That's what I'm trying to say. So that is why I knew that I needed to form a different community outside of friends and family to support me in terms of the emotional aspect of the diagnoses.
Speaking of the diagnosis, what is this type of cancer, doctor?
So, endometrial cancer is a cancer that forms in the lining of the uterus. So, the endometrium is the lining of the uterus. So, we call it endometrial cancer or uterine cancer. It's actually the most common gynecologic cancer in the United States. About 61,000 women will be diagnosed this year alone. Unfortunately, though, it is now the most fatal cause of gynecologic cancers or cancers of the female reproductive tract. So thank you so much for having us here today to talk about it and help raise awareness.
So, Kristen, tell us about your experience and how you advocated for yourself.
The primary means in which I did so was just to keep my providers informed of any physical changes that I had experienced, even prior to my diagnosis. I've always been a stickler for letting my care team know about any concerns that I've had. So that's been the way that I've chosen to advocate for myself. And I've also encouraged other women to do the same, especially those that have had a similar diagnosis, any type of gynecological cancer diagnosis.
So, doctor, how is this advanced cancer treated?
So, one important new advance to talk about is immunotherapy. So, it's a medication that uses the patient's or body's immune system. This has been approved by the FDA for women with newly diagnosed advanced endometrial cancer, where it's already spread outside of the uterus, or where the uterine or endometrial cancer has recurred. So, one example is dostarlimab or Jemperli. This has been FDA approved in combination with our standard chemotherapy drugs, carboplatin and paclitaxel, for newly diagnosed women with advanced endometrial cancer, where the cancer has spread outside of the uterus, or women who have had a recurrence or a return of their cancer. We do know that immunotherapies, like all the medications that we use, may have some unique and serious side effects, so it's always important for patients to talk to their doctors and see if this is an appropriate and right medication for them. But the data is really terrific, and so we encourage women to talk to their doctors.
You know what's interesting, doctor? I talked to somebody else earlier today, and I keep hearing how these new treatments use our own immune system to help fight these cancers. Can you talk a little bit about this?
Well, immunotherapy has been approved by the FDA in endometrial cancer as well as other cancers, as I mentioned, and it does use the immune system. So it is an important area of research and data in cancer in general. So that's why it's important for us to talk about this as well today. Thank you for this opportunity. We also really want to advocate that women see their gynecologists every year. And of course, I don't know if I mentioned, but any postmenopausal bleeding for elder women in menopause or any young women who have changes in their menstrual cycle, definitely they need to see their gynecologist right away and have a biopsy, We're hoping that early detection will be an important part of catching this disease early before it becomes to these advanced stages.
Kristen, tell us about the emotional impact on your diagnosis and how you're helping others diagnosed with this type of cancer.
I think the emotional impact is one that many forget because oftentimes I've come to find that we can be so immersed in the physical aspects of treatment. So one thing I always try to reiterate is that having like mental health supports around as options to help you navigate through that emotional piece is essential, which is what I've done. And I feel like family and friends again have been a key means by which I have been able to find some type of reprieve during and following treatment. And I decided to make sure that women that have a similar experience as mine were aware that there are resources and other individuals that will support them in their journey as well. And so they don't have to feel alone at all.
Speaking of not feeling alone, Kristen, how important is having family and friends involved?
It's extremely important because I don't feel like no one should ever have to go through this alone, which has been one of the key reasons, one of the main reasons why I decided to move forward with advocacy in this way. Because I remember during my personal experience when I didn't have that many resources, so I don't want anyone else to feel that way if I can help it.
I'm speaking with Kristen Foreman. All I can say to you is stay strong, my sister. Also, Dr. Sharyn Lewin, thank you so much for joining us on Morning Blend.
Thank you for having us.